So welcome back guys. Today we are going to discuss insulin therapy in type 2 diabetes mellitus. So when to start insulin? According to American Diabetic Association 2023 guideline, insulin will be default in what kind of patient, right? So if the patient HbA1c is more than 10% or random plasma glucose is coming more than 300 mg per deciliter, you need to give insulin. If the patient is having significant weight loss, then you need to add insulin. If patient is ongoing ketosis, having urine ketone positive, or patient is female and having pregnancy, you need to add insulin. Now, HbA1c more than 9% with 3 or more anti-hypoglycemic drugs, right? Metformin, sulfonylurea glimepiride, or DPP4 inhibitors, or SGLT2 inhibitors like dapagliflozin, then you need to add insulin in this type of patient. Or patient is having severe organ involvement, or patient is going through an operation in future, that will be perioperative patient and you need to give insulin. Also, if the patient is admitted in ICU or in general ward, you need to give insulin to the patient, right? So according to the algorithm given by ADA, we will follow and we will give insulin according to that. Now, two scenarios will be given to you. Patient is on oral hypoglycemic drugs and still HbA1c is high, like more than 9 to 10%, right? And then there comes a situation where you need to add an basal insulin or a mixed insulin at night, right? Now, if the patient is newly diagnosed, the guidelines suggest that if the patient is coming to you and you are diagnosing as a diabetic, patient is not previously diagnosed, and the HbA1c of that patient comes above 10%, you need to give insulin. Now, these are the guidelines, but this is very difficult in India to give. Alright, so if the HbA1c is high in both the scenario, you will give basal insulin. You will start with basal insulin at night at the dose of 10 units or 0.1 to 0.2 kg per day. Right? Now, if the HbA1c is coming high, why we are giving basal insulin? The clinical studies suggest here that whenever the HbA1c is high, more than 9 to 10%, the common cause or culprit behind is the fasting blood glucose level, which are high. So fasting blood glucose high contribute to higher HbA1c level. Whereas the case is different in postprandial blood sugar spikes, where HbA1c of the patient will be moderate, 7 to 8%, but the postprandial blood glucose level will be high. In that case, you will give the patient bolus insulin, and in this case, you will give the patient basal insulin. Right? That's why if the HbA1c is coming more than 10%, we are adding a basal insulin at the dose of 10 units. Now, you've given the patient 10 units of basal insulin, and still after 3 months, the patient is having HbA1c high. Right? So, what you will do, you will tell the patient to monitor his fasting blood glucose for 3 days. And after that, you will do an average of the first, second, and third day. And if the average is more than 120 or it is 220 or 170, then what you will do, that increase dose by 2 units. Now you can do this increment twice a week, 2 times in a week, right? So you measure this, change on the 4th day, again 3 days you take fasting blood glucose level of the patient, take out the average and increase 2 units. You can do this increment until the dose has reached 0.5 unit per kg, right? And if this dose is given and still patient is having fasting blood sugar level high, then this is the time to add bolus insulin to the regimen, right? So you have to do this 3-day step until the fasting blood glucose is high, or if the dose is reached maximum level, you now need to add bolus insulin, which will be extrapid. The content is human regular insulin, right? or you can add the Lispro as part rapid acting ones. Now, if the patient is having HbA1c on presentation moderate, 6 to 9%, then you need to do postprandial blood glucose level, which will not come in control if the patient is having hyperglycemic symptoms. Then at that step, you need to add bolus insulin, not basal insulin, right? So in bolus insulin, we were giving at the night time, bedtime. In bolus insulin, we will give at the largest meal of the day where the carbohydrate intake is high. If, for example, patient is having a heavy breakfast in the morning, you need to give bolus insulin before the meal at breakfast, right? Now, if adding bolus insulin, in that case, if the patient is on sulfonylurea or DPP4 inhibitors, which are insulin secretagogues, they work by increasing the secretion of insulin. Then in this case, if you are going to add bolus insulin in the patient or basal insulin, patient is likely to be having beta cell exhaustion. So in that case, sulfonylurea or DPP4 inhibitor might not be the most useful drugs. So you might need to decrease the dose or stop also. Right? You need to stop the insulin secretagogues. But you can continue the metformin. Now after adding the bolus insulin, still postprandial blood sugar are high. We will do the same method we have done in the basal insulin treatment. Is that check every 1, 2, 3 day postprandial blood sugar level, take out the average, and you can do the increment of 1 to 2 unit of bolus insulin. And if the blood sugar are going to be controlled, you need to continue that regimen, right? Now, if still after doing these increments, patient is still having postprandial high blood sugar or HbA1cs of the patient is high, you need to give insulin before breakfast, before lunch or dinner, which will mimic the regular insulin profile in a normal person, which will be at breakfast, lunch and dinner. So this will be going towards basal bolus regimen completely. Right now in India, you might not find the patient who can take insulin shot 4 times a day. So for that, there is premix insulin, right? So premix insulin will be having NPH, which will be an intermediating insulin, which will work 12 hours, right? And act as a basal insulin and also contain regular insulin, which will act as bolus insulin, which will be at a formula of 70-30 you will get in the market. What you will do in this case is that you will calculate the dose by multiplying 0.3 or 1 unit per kg of the patient, and you will get the total daily dose. And you will give the 2/3 of the dose in the morning before breakfast and 1/3 at evening before meal, which will be a human mixed dose, and which will be very easy for the patient because patient has to take insulin shot only twice a day, right? Before breakfast and before meal, right? So thank you for listening. I hope you understood. Like, share and subscribe please. Thank you.